So my name is Dr. Jeffreu Matous, and I am a physician at the Colorado Blood Cancer Institute in Denver, Colorado, and we're part of the Sarah Cannon Research Institute. And at this meeting, we were able to provide an update on a study called Monumental 2. And Monumental 2 is a study where we looked at combinations with a GPRC5D CD3 bispecific antibody called Talquetamab, in combination, in this case, with pomalidomide. So Talquetamab is FDA-approved, and the experimental question was, well, what about combining it with pomalidomide? So we initially presented this 2 years ago at ASH, and the results were extremely encouraging. The response rates were phenomenal, like almost 9 out of 10 people responded very favorably to the combination. And so at this meeting, we have longer follow-up. So what happens when we track these patients over a longer period of time? And that's what happened in the presentation that we have at this meeting. And what we found is that the response rate is still very high in that 90% range, and many of these responses are very great quality responses. What I mean by that is with complete disappearance on normal lab tests of the multiple myeloma on the regimen, which is just fabulous to see for patients. And not only do you get these responses, but the responses, when they occur, last a long time. And so at 3 years, still almost all the patients who responded are still responding, and many of those patients have not needed to go on to any further additional treatments. The other thing we found when we studied these patients longer that were on treatment is that no additional unusual side effects were occurring. Patients didn't have to stop the treatment because of side effects with a longer-term follow-up. So that again showed that we have a regimen that both is efficacious, that is, it works well, and well tolerated. And so in myeloma, we have to remember that what are our goals in myeloma? Our goals are long survival and excellent quality of life. And this is a regimen that looks really encouraging. And it looks so encouraging now that it's going to be compared to existing what we call standard of care regimens in a comparative what we call phase 3 trial, where half the patients will be assigned to Talquetamab and pomalidomide, the other half will get what we think right now is the standard of care. So stay tuned for that.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.